So it varies a lot what our team is doing, and I'm very proud of them. I must say the last 3 months have been quite busy and sometimes unpredictable. Hundreds of calls, emails, meetings, very often virtual, but the real aim is that we ensure that there is best COVID outbreak response available to Ukraine. Today in our team in Ukraine, who majority of colleagues are staying in Kiev, they are more than 50 people. They come from more than 10 different countries. We have a lot of Ukrainians, but we have other colleagues are coming from different parts of the world. In the beginning, only our emergency team was concentrating to COVID-19 outbreak. But gradually, I would say majority of our team is working on COVID-19 in one way or another. We started support in the very beginning with the personal protective equipment to the hospital where the first case was. And that was very, very important to ensure that the doctors, nurses, and the frontline workers are well protected. Gradually, we have increased the support through the laboratory investment. We are helping the country to have, in all the oblasts, sufficient laboratory capacity to do more testing, because we need to do more testing to diagnose where the disease is and to provide proper treatment. So we have had thousands of Ukrainian doctors and nurses in different trainings on clinical practice, how to use personal protective equipment. And we have still much to do, that everybody knows how to protect themselves, because it starts from very simple things. How we wash our hands, how we have the cloth etiquette, how we ensure that there is some physical distancing. What I would say is that I would not recommend yet to shake the hands. I would recommend to stay vigilant, but at the same time, be close to your friends, your family. Maybe you cannot visit them physically, but you can still call to them, you can still relate to them, and that is very, very important. Because at the end of the day, we want to go back to work, we want to see our friends, we want to go back to the streets, but at the same time, we don't want that there are too many cases of COVID-19. Because we see every day that there are cases of COVID. We are in the middle of the first wave. We assume that there are other waves to come, and that is important that we get everybody prepared. What is important is that COVID-19 tends to be a disease that will stay with us. What is important is to find as soon as possible vaccine, as well find out the best treatment. So your question, if the world is different after COVID-19 outbreak, yes, it is definitely different.